So here are 10 signs of vitamin D deficiency that you need to be aware of if you really care about optimal health. Number one, we first need to realize that vitamin D is not actually a vitamin. In fact, vitamin D is indeed a hormone. It's a steroid hormone that has existed on the Earth's surface for 750 million years and regulates many cellular mechanisms. After being produced in the skin by sunlight or dietary intake, it is converted to biologically active 1,25-dihydroxyvitamin D in the liver and kidneys, respectively. Although the effects of vitamin D on skeletal and bone metabolism have been well recognized for a long time, its extraskeletal effects have gradually come into prominence within the last 20 years. In addition, its effects on the regulation of the immune response, oxidative stress, cancer biology, and the nervous system are particularly substantial. So here are the main signs of deficiency associated with vitamin D. So if we're low in vitamin D, here are the common symptoms and signs that most people can display. First up, we have fatigue or low energy, hair loss, depression/anxiety, joint pain, and muscle pain can also occur. Some other signs are impaired wound healing, low testosterone, poor immune system, and poor focus and cognition. While optimal levels of vitamin D range from 125 to 175 nanomoles per liter, a 2023 systematic review and pooled analysis of 308 studies found that around 76% of participants had less than 75 nanomoles per liter, which indicates that many people have a vitamin D deficiency. Number one is fatigue and low energy. So looking at fatigue and low energy, which is a common sign of vitamin D deficiency, it can be seen from this study that vitamin D supplementation was associated with a reduction in fatigue in multiple sclerosis patients. Among 149 patients, 90% were vitamin D deficient. After vitamin D supplementation, health-related quality of life and fatigue scores improved significantly. There was a direct association between health-related quality of life with absence of fatigue and vitamin D status at the end of study. This study, titled Effect of Vitamin D3 on Self-Perceived Fatigue, a double-blind randomized placebo-controlled trial, indicated that a 100,000 IE single dose of vitamin D led to a significant improvement in fatigue levels, with vitamin D being well tolerated by participants. Vitamin D deficiency and fatigue and unusual presentation. Serum 25-hydroxyvitamin D level was low at 18.4 ng/ml. Vitamin D supplementation was initiated. At follow-up in 3 and 12 months, the patient reported complete resolution of daytime fatigue, corresponding to an increase in his vitamin D levels. Possible mechanisms for clinical improvement include effects of vitamin D on components of inflammatory cascades, including tumor necrosis factor alpha and prostaglandin D2, which result in decrease in central nervous system homeostatic sleep pressure. One proposed mechanism for how low vitamin D leads to fatigue is through the effect this deficiency has on systemic inflammation, which leads to an overall disruption in sleep, a key pillar for our health. This in turn perpetuates the cycle of increased inflammation due to lack of quality sleep. This cycle manifests in fatigue and low energy. Number two is hair loss. Role of vitamin D in hair loss, a short review. Hair loss is another common sign of vitamin D deficiency. Vitamin D is intricately involved in growth of hair follicles. Most studies show an inverse relationship between serum vitamin D levels and non-scarring and scarring alopecias. Further, vitamin D has been shown to help with another form of hair loss known as telogen effluvium. Efficacy of oral vitamin D3 therapy in patients suffering from diffuse hair loss, telogen effluvium. Vitamin D3 therapy resulted in the improvement of the condition in 82.5%, p 0.001, patients of TE. The use of oral vitamin D3, 200,000 IU fortnightly, for 3 months resulted in significant improvement in hair regrowth in the patient of TE. Vitamin D deficiency in alopecia areata. Deficient serum 25-OHD levels are present in patients with AA and inversely correlate with disease severity. The role of vitamins and minerals in hair loss, a review. Androgenetic alopecia, AGA, telogen effluvium, TE, are two common types of hair loss. Studies show that supplementing the diet with low levels of vitamin D can improve symptoms of these diseases. Treatment with oral vitamin D alone, topical minoxidil, or combination of both in patients with female pattern hair loss. a comparative clinical and dermoscopic study. Vitamin D level was significantly decreased in patients compared to controls. Oral vitamin D combination to topical minoxidil is recommended to treat patients with FPHL. There is a lot of information that I present here on my YouTube channel. However, if you want to know exactly what protocols are best for your unique biology, then I suggest booking in a free Boost Your Biology strategy session with a senior member of my team, as we'll start to map out and strategize the best action plan for your unique biology. You'll see that linked down below in the video description. Number 3, we have depression, vitamin D and depression by Gordon B. Parker. Highlights. There is adequate evidence for a positive association between vitamin D deficiency and depression. If a depressed individual is deficient, vitamin D supplementation or augmentation can be an effective treatment. Vitamin D deficiency and depression in adults, systematic review and meta-analysis. Lower vitamin D levels were found in people with depression compared with controls, and there was an increased odds ratio of depression for the lowest V highest vitamin D categories in the cross-sectional studies. The cohort studies showed a significantly increased hazard ratio of depression for the lowest V highest vitamin D categories. This meta-analysis on vitamin D and depression also provides strong evidence that vitamin D deficiency is related to an increased risk of depression, and that supplementation is a viable strategy for increasing serum vitamin D levels. 10 meta-analyses of randomized controlled trials revealed significant reduction in depression symptoms, comparing participants on vitamin D supplements to those on placebo. 4 meta-analyses of cohort studies revealed that participants with lower levels of serum vitamin D were at increased odds of depression than those with higher levels of serum vitamin D. The present umbrella meta-analysis confirms the potential benefits of vitamin D supplementation and higher serum vitamin D levels in reducing the development and symptoms of depression. And number 4, we have anxiety. Potential role of vitamin D for the management of depression and anxiety. The majority of clinical studies have indicated that vitamin D supplementation may hold significant potential as a prophylactic strategy for reducing the risk of both depressive and anxiety symptoms in different populations, and as an adjunctive therapy for these disorders. Vitamin D supplementation ameliorates severity of generalized anxiety disorder, GAD. Vitamin D supplementation was effective in ameliorating the severity of GAD symptoms by increasing serotonin concentrations and decreasing the levels of the inflammatory biomarker neopterin in GAD patients. Another key study indicates the benefits of vitamin D and why it may be useful when dealing with anxiety. Molecular basis underlying the therapeutic potential of vitamin D for the treatment of depression and anxiety. Of particular relevance, compelling evidence suggests that vitamin D possesses antioxidant, anti-inflammatory, pro-neurogenic, and neuromodulatory properties, and thus may act in a similar manner to classic antidepressants. In support, several preclinical studies have shown the beneficial effects of vitamin D supplementation in animal models of these mood disorders. Number 5, we have joint pain. This study indicates that a moderate vitamin D deficiency predicts the worsening of knee pain and potentially hip pain in older adults over several years. The researchers noted that it is unlikely vitamin D supplementation would be effective against completely fixing any hip or knee pain, and while some studies show vitamin D supplementation over several months is beneficial for pain levels, more research is needed. This systematic review and meta-analysis here, titled The Association Between Vitamin D Concentration and Pain, indicated that patients with arthritis, muscle pain, and chronic pain were shown to have significantly lower levels of vitamin D concentration. Another study titled Prevalence of Hypervitaminosis D, which basically means too little vitamin D in the body, in patients with persistent non-specific musculoskeletal pain, indicated that all patients with musculoskeletal pain are at a high risk of untreated severe low vitamin D levels. Number 7 is actually impaired wound healing. Now, you may be able to relate to this. This study titled Role of Micronutrients in Skin Health and Function indicated that vitamin D improves our immunity as well as modulating inflammation, angiogenesis, which is the formation of new blood vessels, and wound healing. So as you can see here, vitamin D modulates innate immunity, angiogenesis, and wound healing in skin via VDR-dependent mechanism. Role of vitamin D and calcium signaling in epidermal wound healing. Vitamin D and calcium signaling are critical for the ability of epidermal and hair follicle stem cells to respond to wounding. Vitamin D deficiency with the accompanying decrease in calcium signaling can result in delayed and/or chronic wounds, a major cause of morbidity, loss of productivity, and medical expense. This study here, which was a systematic review including 10 studies, also found that there was a strong link between low vitamin D levels and wounds that were hard to heal. Number 8, and I commonly see this, is low testosterone due to a vitamin D deficiency. This study, titled Effects of Vitamin D and Quercetin Alone or in Combination on Cardiorespiratory Fitness and Muscle Function in Physically Active Male Adults, found that supplementation significantly increased serum vitamin D levels by 87% and was associated with an increasing trend of testosterone. This next study indicated that for overweight men who were vitamin D deficient, there was a significant increase in testosterone after supplementation for a year. This next study, which was a systematic review and meta-analysis, found that low vitamin D levels was associated with a just significant decrease in circulating total testosterone levels. It is likely that vitamin D supplementation will only be useful if you do happen to be deficient already. And next up, within the immune system, so we have a compromised immune system. This study, titled Vitamin Effects on the Immune System, explains why vitamin D is so important for the immune system. As you can see here, the innate immune system is the body's first line of defense. It activates macrophages, neutrophils, and other cells to attack and destroy the outsider. Vitamin D binds to these cells and facilitates gene expression that makes the cells better at killing pathogens. Number 10 is changes in mood or mood profiles. Vitamin D deficiency is associated with low mood and worse cognitive performance in older adults. In a cross-section of older adults, vitamin D deficiency was associated with low mood and with impairment on 2 of 4 measures of cognitive performance. In this next study, researchers found that a vitamin D deficiency is linked with worse emotional states, including depression and higher confusion bewilderment scores. Vitamin D and mood disorders among women, an integrative review. 4 of the 6 studies, each examining a different mood disorder, show a significant association between mood disorders and low vitamin D levels, indicating that some biochemical mechanism may exist between the 2 variables. As we can see here, the possible mechanisms involved in the effects of vitamin D on mood regulation are antioxidant activity, anti-inflammatory activity, production of neurotrophic factors, bioenergetics and calcium signaling, and biosynthesis of monoamines. So here's a reminder how to correct low vitamin D. Number 1 is to first of all try and prioritize getting outside in the sun and exposing your body to sunlight. If you need help calculating how much vitamin D your body is generating in the sun, I recommend checking out the app called D-Minder. This calculates your longitude and latitude and your skin type to determine roughly how much vitamin D you're synthesizing per minute. So definitely check that out. Also, another way to boost vitamin D is actually by using something known as the Mitolux sun lamp. I'll leave that linked down below in the video description. Basically, this device has been shown to increase levels of vitamin D. And then thirdly, we can also, consider supplementing with vitamin D. So this is important if we're low in vitamin D. Taking a vitamin D3 plus K2 supplement combined can actually help to raise vitamin D levels. So we can see vitamin D the natural way, how we can actually generate vitamin D synthesis in the body through the use of sunlight exposure. The skin, through solar radiation, is the main source of vitamin D and provides 90% of the body's needs. Changing lifestyle habits, encouraging a controlled sun exposure, and proper vitamin D diet is a preventive strategy that should be applied in our daily practice to prevent osteoporosis and other diseases associated with low vitamin D. So that pretty much wraps up today's video on vitamin D and its importance, and hopefully you've learned something new about some of the common signs and symptoms associated with low vitamin D. If you did enjoy this video, please like the video, hit subscribe down below, and please leave a comment to help stimulate the algorithm. Otherwise, guys, thank you so much for tuning in. I look forward to seeing you in the next video.